Okay. Seniors out there, Medicare eligible beneficiaries, excuse me. Funny. I was given a seminar at the Mattituck Senior Center last week. What a compliment. The secret shopper stays until the end. Secret shoppers are by CMS, Centers for Medicare and Medicaid Services, and they're there to make sure we do our job compliant and properly. Secret shopper stands up, male or female, doesn't matter, and says, I'm your secret shopper, and you did a great job. So today, what I'm going to do, I'm going to touch on the Anthem situation first. Dear Mr. Regan, me, obviously I'll just pick on myself, your Medicare plan won't be offered in 2013. For those of you out there that have the LPPO, it's a MediBlue preferred PPO. It will not be offered. I'm going to go into that, why it's not going to be offered. But Anthem, A-N-T-H-E-M, has decided to cancel this entire block of business for the 2013 calendar year. Annual election period, AEP, is from October 15th through December 7th. Other than that, you can't buy the product unless you are working full-time and you have credible coverage through your employer. Now, you HR directors out there, make sure your carrier is sending the credible coverage letter to you, the HR person, or to the over 65 people at your firm. It's called the credible coverage letter. You must show that you have credible coverage in order to avoid a penalty. All right? So anyone with questions, please call in 203-757-1320. What I'm going to do today is I'm going to go over like I'm in a seminar. This is how Medicare works, what it does, and how. So obviously, hello, clarity. These are the flip charts you get. But my most important concept here is for you to understand, as a Medicare eligible beneficiary, senior, it's my radio show, I'm going to call you what I want. A is free. You've worked 40 fully satisfied quarters, 10 years. So A is given to you either if you're disabled and you've been disabled longer than 24 months, or you are what we call an age-in. You've turned 65 and you've gotten Medicare A. B, Part B, Producer Nick, you can see that. Part B you pay for, okay? Now this Part B will cost you $99.90. If your income limit is under $27,000 for a single or a widower, actually, I thought it was called widow, but it's widower or a widow. So there's both. Men and women have a different, grammatically speaking, statement. So if your income for a widow or a widower or a single is under $27,000, you can get your Part B premium back. If it's under $38,704 for a couple, you can get your Part B premium back. That is called low-income subsidies. It is a Medicare savings program through the state of Connecticut, and it's also referred to as QMB, Qualified Medicare Beneficiary. Now, there are two parts to C. The first part is a Medicare supplement. What a Medicare supplement does is it states that you retain original Medicare, so your red, white, and blue card in your wallet. When you buy a Medicare supplement, you retain original Medicare. A is hospitalization. B is doctor visits. That is covered 80%. Your Medicare supplement, or some articles refer to it as a Medigap, which was in this particular study, Medigap, they call it. A Medigap plan or a Medicare supplement plan is original Medicare with the 20% being covered. You can use any doctor, any hospital in the country as long as they participate with Medicare assignment. Now, your second type of Part C is referred to as a Medicare Advantage plan. So now you heard me before state that the Medicare Advantage plan is going away for Anthem, A-N-T-H-E-M. They have an HMO Meta Blue that is going to go from $0 to $28, but the LPPO, if you have this plan and you got the letter, you need to make a change for January 1st. All right? So for the 3 carriers that are alive this year and doing well, my coworker Gene and I, we like United Healthcare, we like Connecticut, and we like Aetna, Aetna, not Anthem, Aetna. Those are the 3 that are worth their salt this year. United Healthcare, national. Yes, my friend and colleague, Bob Riley. If anyone looked in the business section of Wednesday's September 26th article, St. Mary's Health System, the parent of St. Mary's Hospital, has hired a veteran hospital administrator who has served as chief financial officer for 5 different hospitals. Well, Bob Riley, 54, a native of Easton, Pennsylvania, came in and conquered and rocked it. I spoke to his staff earlier this morning, and they said it was no problem that I could announce this. United Healthcare is in St. Mary's Hospital Network for an additional 2 years. I talked to my friend and coworker Tom Shute before lunch, and he said that Chad Wabel, the president and CEO, also called in to WATR. So for those of you that didn't see it in the Republican American, you are hearing it on Medicare and You. It is definitely in the network. You have Waterbury, St. Mary's, Yale New Haven, 3 outstanding hospitals. So United Healthcare, Connecticut, and Aetna are going to be the 3 major players. Now, if you're going to buy a Medicare supplement, okay, you use original Medicare and you buy a supplement. A supplement is for the slightly more affluent client who can afford the $250 all day, or for the particular person that doesn't have great health and they need to know that they're going to be going regularly to the doctor, having chemo, having radiation, having something that they're going to need the comfort of knowing there's going to be 0 copayment to the hospital and 0 copayment to the doctor. If you're slightly healthy and you are on a fixed budget, the Advantage plans work. So if you're going to buy a Medicare supplement, there's only 2 carriers that I feel are A-rated carriers: Moody's, Duff & Phelps, Standard & Poor's. Good ratings. It's Anthem, Anthem, Anthem Blue Cross Blue Shield, which is owned by WellPoint, by the way. WellPoint is the parent owner of Anthem. They have an excellent Medicare supplement. The good one that they offer is the high deductible Plan F, which has a $2,000 deductible. It's quite affordable. Don't quote me on the exact cents, but it's about $40 a month. So you look at the $40 a month outlay plus the $2,000 deductible, and then you must purchase a Part D. So when you get a supplement, you must purchase Medicare Part D for drugs in conjunction. When you get an Advantage plan, the Advantage plan wraps the Medicare portion and the prescription portion all in one. The second carrier that I feel strongly about with a Medicare supplement is the United Healthcare plan. It is not AARP, people out there. AARP always, I have clients come into the office saying, well, I've got the AARP. AARP is a magazine, American Association of Retired People. It is not a health plan. So when you're looking at the differences, you need to know that you purchased United Healthcare. It's underwritten by United Healthcare. Medicare supplement, there's only clearly 2 choices. Mutual of Omaha is out there. United American is out there. The Anthem, I can't even show the sheet on the YouTube because it has too much HIPAA information. But the Anthem letter that they sent out to their LPPO people did list a number of carriers on the back. Well, I just like to associate myself with the A-rated companies. They're not the most affordable, but they pay their bills. All right. Now, the second aspect is a Medicare Advantage. People always say to me, especially in my seminars, well, wait a second. If one is a $2,000 deductible and it's $40, and then I have to purchase a Part D, most Part Ds average between the Humana plan, the Anthem plan, and the United Healthcare, they're around $25 to $37. Now, United Healthcare just introduced a Part D, and I'm going to actually talk to one of my friends in Middlebury. She hates insurance. She barely likes me. So she's saying, look, I'm never going to take a prescription. I never need it. But I always tell her, look, you'll get penalized 1% per month that you don't purchase the Part D. Part D for drugs. Does everyone out there know that there's a 1% per month penalty that you don't purchase a Part D? So United Healthcare did a smart thing. They put a 300 and something, 320, don't quote me on that, but I'm pretty sure it's 320, a deductible on the prescriptions first, and they made the prescription drug plan $15 a month. So it's for the person who's not going to take any prescriptions but doesn't want a penalty. Believe me, if 1 year goes by, you're looking at around $10 to $12 a month penalty, and that's a month for life. So get the Part D. There is a misunderstanding. People always say to me, well, you're telling me that these are around $250. I use Original Medicare. How am I always hearing the commercials that have zero monthly premium? And you know the commercials out there. The Connecticut one goes, you know us by heart. And the United Healthcare one is the guy either on the motorcycle or there's money stuck to the guy and it's flying off of him. Aetna has a great product. They are really coming out of the gate strong this year because Aetna got shut down with a cease and desist in 2011. So they've now had a full year to get their complete act together, and it's together. They have a really good product, and it's a zero premium. So people ask me, how can you get all this for zero? It is your money. And my buddy Ferris listening to me out there, thanks so much for the compliment when you called me and asked me for advice on your plan, because I know you're educated and you definitely know what you're doing. You research your stuff. So the fact that you did listen to the show and acknowledge that you understand it, I hope more people are listening out there. You, depending on your age, and I'll pick on myself. I'm 89 years old. I'm looking pretty good. I swim every morning. But at my age, up to $980 per month is being funded to the carriers. Now, they ask me in the seminars, which, by the way, thank you from the bottom of my heart. The Cocoa Keys had about 35 people. The Medituck Senior Center had 33 plus a secret shopper. So those are good numbers. You're really turning out to see me speak, and I appreciate it. So what happened and how did this happen? In 2003, the Medicare Modernization Act was brought into play. 2003, it's referred to as the MMA 2003. The original word for Medicare Advantage was Medicare Choice, but it didn't catch on. It wasn't a catchy name. So they renamed it Medicare Advantage. So how did this work? CMS, Centers for Medicare and Medicaid Services, went to a few large insurance companies, and they said, look, with all the baby boomers coming up, we in Original Medicare don't have enough money to support this system. So if every senior put in a claim, we're on the hook for 80% of the claim. We need to do something to shift risk. Shift risk means they are using your Medicare dollars and they are funding it to the Advantage plans. So depending on your zip code and depending on your age, at 65, it's around $580, and it works its way up to about $1,000, depending on your age. Every month, per member, per month, goes to fund the Medicare Advantage plans. So that's how it's zero. You're never allowed to say free. It is a test question, and you are not allowed to do it. The premium on a Medicare Advantage plan is zero monthly premium. It does include Part D for drug coverage, okay? We refer to that as an MAPD. So I'm going to sit back down and I'm going to explain the rest of this, but making sure you know that the MMA Act of 2003 is really how these plans were brought about. Notoriously before that, it was always a Medicare supplement. Sure. Thanks very much for listening to the show. Michael Regan, how can I help you?
Hi, Michael. I heard earlier in the show you mentioned that Medicare now covers the shingles vaccine.
Yes, absolutely. I have that right here. My coworker Kristen got that all set.
Is it Like in the same fashion that it covers the flu vaccine?
The flu vaccine is actually administered by a Medicare plan for zero copayment. The shingles vaccine is roughly $80 to $89, depending on what carrier you have. Who is your current carrier now?
Part D.
Who's your part? Oh, you have a Medicare supplement, that means.
A Part D.
Okay. Is it Humana, United Healthcare, Anthem?
It's the silver sneakers.
No. It's Silver Script.
Silver Script.
Yes.
That's it.
Okay. You will pay $6.50. No names for HIPAA reasons, but do you have a Silver Connect card in your wallet from the state?
I do.
Okay. You were given that Silver Script card from by the way, did you just get a letter saying that your plan is going to change for 2013? It's going to go up. Are you with did they go up to like $2.30? A lot of my clients are getting letters saying that Silver Script is going to now go up just a couple dollars.
I did receive a letter from them.
Right. Okay. So call me off the air on that one. But I can tell you this easy answer. If you have Silver Script and you have your Silver Connect card, you can go to any local pharmacy and you will pay $6.50 for it. The shingles vaccine is covered.
Okay.
That's
Thank
a
you.
beautiful question. Thank you so much for listening to the show. All right. Rock it. All right. So, am I a nerd? Yes. This is what I do. I consult on seniors. But they need me. There needs to be a sounding board, someone to ask questions to. All right. So let's keep going. With original Medicare, you have A, you have B. This gentleman who just called in gets his Part B premium back. So remember, if you apply for the QMB, you get that back. The reason that was done is because they canceled the ConPace program. So I know that for a fact. That is the reason. Producer Tom's telling me commercial break, just like Producer Nick wants, for 1:40. I'll be back in a few minutes after we plug our sponsors, and I'll continue on.